Washington University provides a high level of care from physicians who are up to date with the most current technologies, techniques, and also provide a very personal approach to medicine. So one of my goals as a surgeon is to help patients be able to get back to what they enjoy in life. And I think that that's what we should strive for, and whatever that might be. And so as a surgeon, I understand that people are coming from different backgrounds and have different functional goals. And so that's one of the first things I like to do when I meet a patient is to know what their specific goals are with their function. And at the end of our journey, what will that look like for them? And it's different for a patient and a physician sometimes, what their expectations are. And so it's great to be on the same page when we first meet. One of the things we're excited about is expanding access to care. And so treating patients with musculoskeletal problems, whether it's a known diagnosis of malignancy or an unknown diagnosis. And so we're trying to schedule patients as quickly as possible, but also to expand the footprint that we're able to treat patients by working with providers that are closer to their home. So because of the rare nature of the tumors we treat, we see patients quite frequently from further distances away from St. Louis. And so being sure to treat patients in a way that makes the most sense for them. And so that might mean having surgery in St. Louis, and adjuvant treatments such as radiation therapy or medical treatment closer to home sometimes is the best for them. And so look forward to working with patients to personalize that plan on a case-by-case situation. When patients need multiple disciplines to help treat one specific problem, we're able to do that as a team without having to seek opinions from other institutions on a routine basis. And so we're able to work with multiple specialties such as radiation and medical oncology, with musculoskeletal radiologists, as well as several other fields such as vascular surgeons and plastic surgeons as necessary to come up with one comprehensive plan. And within those fields, everyone at Washington University has really excelled with teaching, with research, as well as patient care. What I really enjoy about musculoskeletal oncology is that I'm able to join the passion for helping patients improve functionally with their musculoskeletal needs, and also getting to know them over a long period of time. So patients with musculoskeletal tumors often need surveillance of their medical issues for several years, and as opposed to arthritis care and sports injuries, which our colleagues fantastically treat. But I've really enjoyed the patient connection. Being able to take a patient and journey with them through that course of surgery and recovery, and sometimes through ups and downs, is very meaningful, and it's a wonderful thing to be able to share with patients.